Hi, Mrs. Andrews. I'm Allie. I'm from the University of St. Francis, and I came in to do your postpartum assessment today. Before we get started, how are you doing since you've had your baby? Good. Everything, are you feeling okay? Good. I'm going to wash my hands before we get started here. Do you have any questions right now? No? Good. Okay. I'm going to go ahead and start with your vital signs. Listen to your breath sounds. Just go ahead and breathe normal for me. And I'm going to set you up gently and listen on the back here. Good. Okay, I am going to, how's your pain doing? Are you having much? Seems to be okay right now. That's good. I am going to go ahead and start your bubble heat assessment. Put some gloves on here. Okay. Gonna start at the breast up here. Keep you covered. Okay. I'm gonna feel. Does any of this hurt around? No, not tender or anything. Nothing looks swollen. There's no discharge or draining out of it. Normal color. Nipple size is normal. Cover you back up here. I'm going to go down here and check your uterus. Check your fundus is firm. Does that hurt at all? No. I'd say about once every hour, just kind of massage your fundus here. That way it continues to not hurt and you have better healing there. Have you had a bowel movement yet since you've given birth? Good. Passing gas normally? Good. I am going to listen to your bowel sounds here. Okay. And last time you urinated? Good. I would get up, I would go about every 2 hours. And since you had a vaginal birth, it's recommended to get up and walk to the bathroom instead of using the bedpan. So I would do that. I'm going to check your pad here. Check the lochia, and there is bright red drainage, a scant amount. That is normal. I would check that pad about every hour. Please let us know if the bleeding or if the blood clots are bigger than a golf ball size. We would want to know that. That could be a sign of increased bleeding, and we don't want that. I am going to cover you back up here and turn you on your side. Check your episiotomy site here. There you go. Grab onto that rail. Perfect. All right, let's check that site. That is looking good. Stitches are intact. No crust around them or drainage. We can come back here. Lay it back. I'm going to go down to your legs here. Are you having any pain in your calves or legs or anything? No? Good. I'm gonna bend your knee. Check your clonus reflex by bending your foot up and letting it go. Good, and it should go back down like it did. We'll check the other one here. Good. Good. And you do not have a catheter, so we don't have to worry about that. If you had a C-section, we would want to check the incision site, make sure the sutures or staples were still intact. No extra bleeding or draining or discharge. Okay, everything looks good. Let's just check one more thing. Your reflexes here. Your knee, ready, 1, 2, 3, good. And other one, 1, 2, 3, and good. If those reflexes weren't there, that would be, we would have to check into that further. Okay, any questions for me? All right, everything looks good. Thank you.